So now here you can see the sartorius. This is sartorius. Okay, it goes to the medial aspect. It is going to the medial aspect of the knee joint. So this forms one of the boundary of the femoral triangle. So medial border of sartorius, medial border of adductor longus. So apex is directed downwards, base is directed upwards, and that is formed by the inguinal ligament. You can see this white glistening thing, no? That is inguinal ligament. So now here, inguinal ligament, medial border of sartorius, medial border of adductor longus. That means what? Adductor longus is part of the femoral triangle. So adductor longus, and then you have iliopsoas and pectineus as the floor of the femoral triangle. So to coming to the contents, you can remember this as navel, N-A-V-E-L, from lateral to medial side. N is for femoral nerve, A is for femoral artery, which you can see here, femoral artery. Then there is vein. So here what you can see, the thin one is the great saphenous, which is draining into the femoral vein. Okay, there is a small cribriform fascia. It is a falciform fascia. It pierces that fascia and opens into the opening, that is called the saphenous opening. Okay, so this is great saphenous vein draining into femoral vein. So we can't retain all that if you want to do the deeper dissection. So we have removed that, and now you can see the adductor longus here. You can see the other structures at the floor. You can see the sartorius here. Then you can see the other quadriceps, 4 quadriceps. One is the rectus femoris right in the center here. This is rectus femoris. Rectus means straight. Okay, this is straight muscle right in the center. It is going to the tuberosity. Okay, tibial tuberosity on the tibia, that is crossing the knee joint. So it is a very good, flexure of the, extensor of the knee joint. Okay, whatever joint it crosses, it acts on the joint. So in this case, this is the extensor compartment. So it will extend the knee joint. Okay, this is rectus femoris. Don't get confused with the biceps femoris, which is part of the hamstrings. Okay, this is rectus. So this is lateral aspect. So this is vastus lateralis. That side bulkier muscle is vastus medialis, and beneath that, whatever beneath this is intermedius. You cannot really separate the intermedius because it is attached to the anterior surface of the femur. Okay, entire bulk is attached to the anterior surface of the femur. On the side, you can see here, if you focus, you can see some glistening thing. This is nothing but the fascia lata, but you can also see there is a band-like thing that extends from here. Okay, it is formed by 2 important muscles. One is, there is a tensor fascia lata, small muscle coming from the iliac crest, and there is another one, gluteus maximus, coming from the back. So together, the fibers of those 2 along with the fascia lata, they form a iliotibial tract, and that's a very important structure to maintain, okay, the stability of the knee joint during half-sitting position. Okay, like you get up from your seat and you don't have to hold anything, but you can still get up without any support. So that is done by what? That is because of the support of the iliotibial tract. That is on the lateral aspect. Okay, so there is no compartment on the lateral aspect, but you have iliotibial tract. So which compartment is absent here? Lateral compartment is not there, but you have extensor compartment, which is made up of quadriceps. Then you have posterior compartment, which is made up of hamstrings, and you have medial compartment, which is made up of adductors. How many adductors? 3 adductors. Adductor magnus, longus, and ribs. So adductor longus is one of the important muscle which forms the floor of the femoral triangle as well as the boundary of the femoral triangle. Understood? And on the medial side, you will see one thin muscle extending, on this side you can see. This is called a gracilis. We need to clean this a little bit more. This is called a gracilis. It is also one of the important muscles to use it for grafting. Okay, this is called gracilis. Obviously, it will do the action of adduction. Adduction means what? Bringing your thighs close to each other. Is all these are adductors. Okay, this is gracilis. Then this one is adductor longus in this case, and you have to see the other structures, but here what has happened is they have used this leg for embalming. Okay, so lower limb for embalming. So you can see that so many things are damaged. Understood all of you? Okay.